Thank you, Mr. President. If Senator Rivera will answer a few questions on Part R, Emergency Medical Services. But, Mr. President, before I ask the questions, I'd like to go on the bill to give a brief background.
Senator Helming on the bill.
So back in March of last year, the New York State Comptroller issued a report on emergency medical services, and I want to read the first couple of lines from his conclusion. It reads, reliable ambulance services are a public health imperative, literally a matter of life or death. New Yorkers expect to receive timely and capable emergency medical services when needed, without having to worry about all the things that need to be in place to make it happen. I think probably everyone on this floor agrees with that sentiment, and that's the reason why 3 years before the Comptroller issued his report, this body took action. We passed the Rural Ambulance Services Task Force. We created a task force to study the challenges in our rural communities with quality of service, with delivery of service, and to make recommendations back to the state of New York. So now on to my question for Senator Rivera, if he'll yield.
Senator Rivera, do you? Senator yields.
So Senator Rivera, what I'm wondering is if the task force recommendations were taken into consideration when we were developing, or when the majority and the governor were working on Part R, emergency medical services.
Mr. President, Part RR is no longer part of the finished budget.
Through you, Mr. President, if the sponsor will continue to yield.
Sponsor yield?
Yes.
Sponsor yields.
Senator Rivera, have you ever seen the recommendations from the task force?
Through you, Mr. President, yes, I have.
Yep. Through you, Mr. President, the sponsor will continue to yield.
Sponsor yield.
And
Yes.
Senator
Sponsor
Rivera,
yields.
I want to say thank you because over the last several years, I've asked during the budget hearings, I've asked the commissioner of DOH for a copy of that report, and there's just like a blank stare. I actually ran out of time. I couldn't ask the question this past hearing, and you asked the question for me. So was it after you asked the question that the Department of Health made that report available to you?
Through you, Mr. President, I should restate. I am aware of some of the general recommendations, but I have not had the report in my hands.
Yeah. Through you, Mr. President, quickly on the bill. I'm
Senator
not sure the
Helming on the
report
bill.
exists, but if the sponsor will continue to yield the questions.
Sponsor yield. Sponsor yields.
Senator Rivera, the governor's budget included language which would have designated general ambulance services as an essential service. Why was this excluded from the final version of this bill?
President, I will tell you that, as I stated a bit earlier, all the positions of the majority conference in the Senate were clearly expressed in our one houses, and I'm sure that you remember. And one of the things that we did, and I'd want to certainly point out Senator Mayer's insistence that we get something done on this. Unfortunately, an agreement was not able to be reached. Our colleagues in the Assembly did not share the level of concern that we have for this issue. But as I said, many of us, and certainly I know that Senator Mayer cares deeply about this issue, knows more about it than probably anybody else in our conference. And I look forward to working with her to see if we can get something done before the end of the year.
Through you, Mr. President, on the bill briefly.
Senator Helming on the bill.
So I want to go back to the Comptroller's report from March of 2024. He says the stakes are too high and the issue is too complex for counties and other local governments to have to address on their own. The current circumstances call for direct state involvement to support the efforts of counties and other local governments to turn fragmented and ad hoc responses into comprehensive solutions. So, Mr. President, if Senator Rivera will yield for a few questions.
Senator, will you yield? Yes. Senator yields.
So, Senator Rivera, with Part R omitted, which would have established special districts to finance and operate general ambulance services and provided for a statewide comprehensive emergency medical system plan, what in this budget will help ensure access to EMS services, especially in our rural communities?
There is one part KK if I'm not mistaken, that did increase user fees. Extended user fees for a 5-year period, and that is unfortunately the only thing that we could actually get into the final budget that will help this area.
Through you, Mr. President, if the senator will continue to yield.
Sponsor yield?
Yes.
Sponsor yields.
Senator Rivera, I would argue that that is not new, that that is just an extension, right, of something we already have, and our ambulance companies are suffering. So in my opinion, and I'm curious whether you agree or not, that this doesn't do anything or much to alleviate the issues that we have.
Mr. President, I actually will acknowledge, as my colleague said, that it is not a new thing. Instead, it's an extension for 5 years. And I will also agree with my colleague that we did not do enough in this budget. But again, this is what was ultimately agreed upon after much pained negotiations over the last couple of weeks.